In this video, we are going to talk about the T wave, which represents the ventricular repolarization. The ventricles have now contracted, and the blood went out of the heart into the body. We've seen this through the QRS complex and the ST segment. Now the muscle needs to recover and reset to prepare for the next beat. This recovery, also called repolarization, is called the T wave, and it behaves in a way that surprises almost everyone. The T wave represents ventricular repolarization. In other words, it's the process by which ventricular cells restore the resting electrical charge after depolarization. As this happens, the ventricular muscle begins to relax. Now, here's where things get interesting. Repolarization does not travel in the same direction as depolarization. During depolarization, the electrical wave spreads from the endocardium to the epicardium, moving from the inside of the ventricular wall towards the outside. But during repolarization, the opposite occurs. The epicardium repolarizes before the endocardium because epicardial cells have a shorter action potential duration. As a result, the wave of repolarization travels from the outside of the ventricular wall towards the inside. And this explains one of the most confusing features of the ECG. Why is the T wave usually positive despite the wave being negative? Because repolarization is a negative electrical wave, and that negative wave is moving away from the positive pole of the lead. And repolarization is a negative electrical wave because the positive ions move outside of the cell, opposite to depolarization. Now here is the answer to the question. A negative wave moving away from the positive electrode produces a positive deflection on the ECG. So even though repolarization is occurring as a negative electrical wave, the T wave in most leads appear upright. The T wave is normally upright in leads 1 and 2 and inverted in AVR. And it's upright in leads V3 through V6. In V1, the T wave may be inverted and still be considered normal. The normal T wave is asymmetric. It rises gradually and returns to baseline more steeply. The loss of this asymmetry, particularly the development of a tall symmetric T wave, may indicate abnormal repolarization and can be an early sign of ischemia. This morphology is often easiest to appreciate in leads 2 and V4 through V6. You can pause the video to see it clearer. The T wave amplitude should be less than 5 millimeters in limb leads, which is 5 small squares, and less than 10 millimeters in chest leads, which is 10 small squares. Duration is not routinely measured independently. It is captured as part of the QT interval. What matters most about the T wave is its shape, direction, and symmetry, not just its height. Abnormal T waves may appear inverted, unusually tall and peaked, flattened, or biphasic. Any T wave that looks noticeably different from what is expected in that lead should prompt you to look for an underlying cause. The T wave represents ventricular repolarization. It reflects the recovery phase of the ventricles after depolarization. It is normally upright in most leads because ventricular repolarization occurs in the opposite direction to ventricular depolarization. Its morphology and direction helps determine whether repolarization is occurring normally and its symmetry can reveal important abnormalities in the repolarization process. That's all. Thank you and see you in the next lecture.